Hi, everyone. We're very glad to see you here. My name is Marina Moses, and I'm on the faculty of the Health Administration Department. I want to quickly remind everyone to please keep yourselves on mute throughout the panel. This year, we are celebrating, supporting, and cataloging our ongoing climate work happening at all levels of the university and the Academy of Natural Sciences, as well as launching new initiatives, curriculum, and civic engagement activities. One initiative has been this series, the Climate Year Speaker Series, where we highlight work from different departments, faculty and staff throughout Drexel and the Academy of Natural Sciences. Today, our focus is on the implications of climate change for human health, with a focus on urban settings. We're going to hear from 4 speakers, and then we're going to have time for questions and discussion after each speaker has presented. Now, I'd like to turn things over to our moderator today, Meghan Conroy. Meghan is a senior health services administration major in the College of Nursing and Health Professions. She currently is on co-op with the American Public Health Association as a research assistant. In addition, she's a member of the varsity Drexel softball team. Meghan, please take it away.
Thank you, Dr. Moses. Now I'd like to introduce our first panelist, Dr. Jerry Fagliano from the Dornslave School of Public Health. Dr. Fagliano is the chair of the Department of Environmental and Occupational Health. Thank you, Dr. Fagliano.
Hi, everybody, and welcome. Thank you for taking the time out of your middle of your day in a beautiful August afternoon. My task today is really to sort of set the stage for the other 3 speakers and give an overview of climate change and health, and with a specific focus on the urban setting and the particular implications in that. In populations in urban areas. So I'm going to give a quick overview of the summary of the kinds of environmental changes that we are anticipating or that are happening as a result of climate change, how these changes can impact human health, factors that modify whether or not certain people may be more at risk than others, focus a little bit on urban areas and why those particular populations can be at greater risk. Talk a little bit about vulnerability and how we think about vulnerability from a public health perspective. And I want to just give a few updated projections of climate changes from the new Intergovernmental Panel on Climate Change report that was initially released last week. And then talk a little bit about public health framing for how we respond to climate change. So in a 30-second overview of what we are experiencing, our planet is warming due in large part to the burning of fossil fuels by human beings, especially over the past 60 to 80 years. The accumulation of carbon dioxide as a result of that burning of fossil fuels through the greenhouse effect is warming our atmosphere, in turn warming the oceans. And as a result of that warming, it can also lead to sort of a cascade of other impacts, such as more severe storms, greater risk of heavy precipitation events, which of course can impact anywhere in the globe, and in urban areas specifically. That warming of the atmosphere and the oceans also results in a rise in sea levels globally from both thermal expansion of seawater, simple physical manifestation of warming of water, but more importantly, especially as time will go on, the melting of land-based ice, which will raise sea levels potentially in a catastrophic manner in the next couple of centuries. In addition to the fact that carbon dioxide goes into the atmosphere, it can also then enter the marine systems, thereby acidifying the oceans, which has implications. All of these changes that I'm talking about are altering land and marine ecosystems, including and relevant to human populations, those that which we depend for our food, for our habitation. So agricultural lands, fisheries, and the cities we live in are being altered and will be altered even further as time goes on, which we'll see in a moment. So those are the kind of changes in the environment that are going to be happening. And there's one nice way to frame this all that the National Climate Assessment put forth a couple of years ago, which here in the top box are those environmental changes, what they're referring to as climate drivers: increased temperature, greater precipitation, sea level rise, operating through increasing exposures to different kinds of hazards, such as extreme heat events, increases in poor air quality, more complex causal chains that result in changes in food availability, food quality, water quality, differences in the way insects or insect vectors or insect pests may be distributed that can change risks of disease, infectious diseases, or food production. And these also can lead to migration of human populations, displacement from the impacts of various kinds of environmental change. These all then can lead to both direct and indirect kinds of health impacts on people, from the direct effect, say, of heat-related illness or injuries from extreme storms, through more complex kinds of impacts, as I mentioned, food and waterborne disease, maybe cardiovascular illness from air pollutants. And in addition, the strain and stress of these kind of events can result in serious mental health consequences. So there's this pathway from climate drivers to health outcomes that is critical for us to sort of the way we should think about environmental or climate change's impacts on health. What's also really important about this diagram are these two sets of contextual factors that can modify the way in which these climate drivers ultimately result in health outcomes. So what these contextual factors indicate is that how we respond societally or institutionally can have a big impact on the degree to which health impacts happen. And also these other kind of social and human behavioral contextual factors also can modify, magnify, or even if you think of them in a more positive way, we can use manipulation of these kinds of factors to mitigate or reduce the risks from these climate drivers. I'll come back to that at the very end. So how does this differ in cities, or how might it be magnified? Well, some of these changes in the environment can be intensified in cities. For example, the urban heat island effect leads to more intense warming in cities. It also can lead to more intense precipitation events as well in and downwind from cities. So cities can experience, or people living in cities can experience, more severe impacts. Sea level rise obviously has a huge impact on large numbers of people who live in coastal cities, which is a large number of people now, and with increasing urbanization across the globe will in fact become a more important problem as time goes on. Storm surges, extreme precipitation in combination with, or sort of compounded by, sea level rise can also make flooding in cities more likely. Cities are also places where there are, very large social inequalities. These are some of these contextual factors that can make the impacts of climate change greater in some portions of our population. So cities are again places where that can be seen to its extreme. Cities are also, centers of our economic, sort of their economic engines, and so disruptions that occur in cities to industrial operations, to energy production, water and transportation systems, all can have severe impacts in urban areas as well as outlying populations as well. And finally, I think an important issue related to urbanization or urban areas is that urban areas are places from which large numbers of people may need to migrate, and they also be places where people who may be fleeing climate impacts in rural areas and agricultural production areas may flee to. So cities can become places where migration can create lots of social conflict as a result of these changes. So I want to talk a little bit about vulnerability and how we can think about ways in which certain populations can be more vulnerable. And there really are kind of three ways that I've listed here. One is that some populations may simply be more exposed to adverse conditions because of where they live. If they're at sea level, for example, or they're in an area prone to drought. So where populations live risk can vary quite dramatically because of the specific location. What one does for work can also increase exposure. For example, people who need to work, say, or whose jobs bring them outdoors, farm workers, construction workers may be at higher risk because of what they do in a particular area. And then conditions of shelter, homelessness, the ability or the capacity of a shelter to provide cooling or other factors is also one aspect of vulnerability. People may differ even under the same external conditions they may differ according to their susceptibility by age. Youngest people or oldest people or some kinds of medical conditions may make people more likely to be harmed because of a particular level of exposure. And finally, what's important in this last bullet is that some people in a given set of conditions may have a greater or lesser capacity to act to protect themselves or to protect their families. Some individuals may not live autonomously because of physical or mental factors. Or age. Children, for example, would be a good example. And also those living in poverty. So if one is unable to afford, say, air conditioning or afford to flee a storm because of transportation deficits, that is another level or degree or factor that could result in greater susceptibility or vulnerability to climate changes. So let me go through just a few of the most, these are graphics that were just put out by the Intergovernmental Panel on Climate Change last week, which are the most recent kinds of projections. And I just want to give some examples of how these environmental changes are happening and how they may be projected into the future. So this graph shows over the past 2,000 years or so, the average global surface temperature as reconstructed over most of that time and as observed recently. And as you can see that in the most recent few decades, the temperature from a baseline around this period has been increasing rapidly. We've all seen this now. This is just another way to present this. And what's also interesting is that this is showing that what we are now experiencing is really unprecedented in the past 100,000 years or so, which is pretty mind-boggling to think about. Most of this increase, this is a graphic from NASA, most of this increase has been occurring really in the past 40, 50 years, and that rate of change is accelerating. The increase has been accelerating in the recent decades. Looking forward, and the sort of projections, the most recent projections put out by IPCC last week show that here we are now, we've seen this recent increase, and our future can take many, many different shapes. And I think what's important about this is that the optimistic scenarios for future projections, which are really based on our capacity as a global community to reduce the kinds of emissions of greenhouse gases and to take other steps potentially to mitigate climate change. We have within our power over the next few decades to see a future that is worse than today, but not catastrophic, that we can, we have within our power the ability to really affect over a broad range of possible futures what we will experience. And if we do very little or nothing in these pessimistic scenarios, we are looking at catastrophic scenarios for increased temperature. But I think the main message that the IPCC is trying to get out is that we still have within our power the ability to affect the degree to which the climate will be changing. This is also can be illustrated in these two graphics here, which show for two cities, Phoenix and Pittsburgh, projected numbers of excessively hot days in the next several decades. And as you can see from these sort of optimistic scenarios in blue to the more pessimistic scenarios in red, that we are seeing some worsening regardless of what we do, but again, the degree to which these changes will worsen can be impacted by what we do today. Some of these, for example, in Phoenix, more than 60 days above 110 degrees Fahrenheit by the time of the end of the century are pretty awful to think about. And so we need to try to aim for this rather than that over the next couple of decades. As far as precipitation goes, heavy precipitation events have been observed and are seen to be worsening over much of the globe. This is a kind of a interesting way of showing the U.S. or the sort of the global map. But in much of the world, we see increases in heavy precipitation events happening, and what's projected is that it can also become worse over time. What's interesting about this is I'm going to show another way of looking at that, or a different way of looking at rainfall, which is the occurrence of drought. So long periods without rainfall can also become worse, has been shown to be worse actually over the past several decades. And if you toggle back here, you can see that some areas will actually are actually seeing more drought, but also more heavy precipitation events happening in the same location. So cities can anticipate the potential for water stress because of drought, but also water stress related heavy precipitation as well. Finally, I just want to this last part of the IPCC graphics I want to show is the projections for mean sea level rise through 2100. And you can see, again, we have to some degree the capacity to control the degree to which sea levels will be rising. These are without sort of catastrophic processes happening this dotted line shows the potential for maybe really worst case scenarios. But what's really important about this also is that if you look on the right side of this graphic for the year 2300, so looking at multiple centuries, we have the capacity where we are anticipating very, very large increases in sea level rise, even under the best of circumstances. So the prospects for coastal cities in the long run is pretty grim based on these projections. So just to think a little bit about framing risk reduction from a public health perspective, mitigation or primary prevention in public health language is all the steps that we need to take to prevent those climate changes from happening in the first place. Energy conservation, clean energy transitions are absolutely essential, and these messages are being put out very strongly by the IPCC. The need to work on this aspect of prevention as quickly as possible. At the same time, because changes are happening and are inevitable, we need to be able to prepare our urban areas and all of our populations to minimize those impacts that will be changing. And again, even if we do the best job, there will be a further warming of the planet. And so all these kind of activities that are listed here are essential to prepare our populations to at least minimize the damage or the impacts that are going to happen. And finally, we need to be able to return communities to states of health and well-being when disasters do happen. So it's sort of a third level of prevention, of being able to be resilient and return to a sense of functioning or state of functioning once disasters have happened. So that's where I'm going to end, and I look forward to having an opportunity to speak more in the discussion period. So thank you.
Thank you, Dr. Fagliano. Now I'd like to introduce our second panelist, Dr. Josiah Kephart from the Urban Health Collaborative. Thank you, Dr. Kephart.
Hi, everyone. It's great to be here. Thank you, Dr. Fagliano, for your introduction. And today I'm going to talk specifically about extreme heat and mortality and some research that we're doing within the Urban Health Collaborative on heat and mortality within a large number of cities in Latin America. And this ties in really nicely with the introduction just given, and there are a lot of consistent themes. So we know that extreme heats, and when I say extreme heat, I mean outdoor heat or ambient heat, has a wide range of different health impacts. And we hear a lot about heat stress, about heat stroke, but in general, that being outside or being inside, if the temperature is warm enough, puts a lot of cardiometabolic stress on your body, and this burden can lead to a lot of different poor health effects, both in the short term and in the long term. And mortality is probably the best studied health outcome when it comes to heat, at least in terms of the global literature, probably because it's very easy to quantify. And a recent study came out in the Lancet Planetary Health just this year. This is this map here on the right side of the screen that did this global modeling of the number of heat-related deaths per year. And you can see here in this map on the right, the blue color is fewer deaths. The red going to brown color is a higher number of heat-related deaths. You can see this is really a global problem. There are heat-related deaths occurring across the globe. You can also see that this is not necessarily distributed evenly across the globe. And this makes a lot of sense, of course, because different areas have different climates. But there's a lot of variation across the world in the ability to adapt to heat. Now, this might be whether you have air conditioning, this might be the construction materials that is locally available within your region. And this really becomes a major environmental justice issue because generally folks who have more money are better able to adapt or to protect themselves from the health effects of heat. So this study estimated that 0.91% of total deaths globally can be attributed to heat. And this is a pretty big number here. So extreme heat is really there are a lot of different factors that are converging together to make urban heat a really major public health problem within the 21st century. First of all, as Dr. Fagliano was just talking about, we've got this background of a warming climate, which was not, changes in that are not evenly distributed around the world. We've also got increasing urbanizations across the world, so more people live in these urban areas than ever before. And we have this heat island effect. And this is sort of this image on the right here. It gives just a little picture of that, where you have these temperatures are higher in downtown or more built up areas than in greener areas. And a lot of this has to do with the heat being absorbed within the buildings. You can think about standing in the middle of a hot parking lot compared to a grassy field. There's also less shade in the cities. You don't have as many trees to absorb that heat compared to more rural areas or more green areas. We have more people living in cities and we have hotter temperatures within cities, right? Now, both between cities, but also within cities, you have these wide social disparities that are going to have a big impact on the health effects here. You've got disparities in exposure. So who within, say, Philadelphia is exposed to this extreme heat versus not? And an easy example of that might be who has tree cover or otherwise shade and who does not. You have disparities in the ability to cope, like do you have air conditioning or not? And you have disparities in these underlying physical vulnerabilities, such as your age or other chronic diseases that may make you particularly vulnerable to the health effects of heat. So heat, as I mentioned before, these converging challenges of the 21st century, this is particularly acute within Latin America. Latin America is the world's most urbanized region. Currently, 80% of people in Latin America live in urban areas, and that number is increasing. Latin America has an increasing number of older people as the sort of demographic transition occurs. And we would expect major temperature increases with climate change. And this is similar to the plot that Dr. Fagliano just showed about Pittsburgh and some other cities. You can see here this map on the right. So what this map represents is there was a study from 2 years ago that said, okay, what's a very hot day right now in Latin America? So this is 95th percentile above, so your hottest 2 weeks roughly of the year. Now, how many of the days in 2050 will be the temperature that we consider very hot right now? And you can see here on this map, this is South America, of course, within Northern South America, you see upwards of 40% of days in mid-century are projected to be what are considered very hot days now. You can see across the whole continent, even further south in the more temperate areas, around 15-20% of days mid-century are projected to be what are considered very hot days right now. And as is true with a lot of environmental epidemiology, the existing research is highly centered and focused on high-income countries, North America, Europe, and China. But because there's such variability in exposure and in these health outcomes across the world as it relates to heat, we really need a region-specific understanding to inform local adaptation efforts. So I want to give a brief introduction to the Solar-Val project. I won't do it justice, but Solar-Val project is an international collaboration that's hosted within the Urban Health Collaborative that looks at how urban environments and urban policies affect health across cities in 11 countries in Latin America. And we have partners at institutions from within 7 different countries. And this effort is funded by the Wellcome Trust. So this project we're based at 3600 Market Street at the Urban Health Collaborative, is compiling massive amounts of data on the environment, social factors, and health factors for 371 cities with 100,000 or greater inhabitants to really try to understand how urban policies can promote public health. So I'm going to be presenting some results from the HEAT project at Sotherball. This just to give you kind of a bird's eye view of our research goals as it relates to understanding this impact of ambient heat on health. The first phase is looking at recent climate, trying to connect this, determine these associations between ambient temperature and mortality. And then also to look at how the urban environment impacts vulnerability. Think about differences in the built environment, natural environment, social environment, and how that might impact the health effects. And the second phase is to project forward what we learned in phase one to mid-century climate scenarios using different modeling approaches. What I'm going to be talking about today is this first step in phase one of really just understanding this sort of baseline relationship between temperature and mortality. So I'm going to just walk you through the methods here. So our study setting is 326 cities from 9 Latin American countries. Our time period is 2002 to 2015. This varies a little bit by cities, but this is the general time period according to data availability. Our level of analysis is at the city level. And what we're doing is this time series analysis that's looking at daily temperature and daily mortality counts within these cities. And our temperature, our exposure metric was created using the ERA5 land data set, which is satellite based. And our mortality counts come from government records, vital records. That's what I was thinking of. So our general moderating approach, as I mentioned, this is a time series analysis. We're using nonlinear conditional Poisson regression, which is the standard, most common approach within this field. So our analysis has two stages. First, we're looking to estimate these city-specific exposure response curves between temperature and mortality. And then we're pooling these city-specific exposure response curves with random effect meta-analysis to get these overall effects. And I just want to show you this map here on the right. This is just a description of the annual mean temperatures during our study period. You can see there's the lighter temperatures or the more yellow or hotter temperatures, and the cities with the more purple or blue have colder annual mean temperatures. You can see there's a lot of variability here across the region, which we would expect. Of course, this region has a highly variable climate. So this is our table one, our description, and I want to direct your attention to this top row here within the purple square, just so you get a sense of our study population. Again, the median population of the cities we're studying is about 267,000 people. And this goes up to mega cities with tens of millions of people, as well as down to smaller cities of 100,000, which is our minimum. You can see the percent female here in the middle, it's 51%. Proportion of the age over 65, which is important because older folks tend to be more vulnerable to the effects of heat, about 6.6% in the median city. Then number of annual deaths here. So this is, gives you a sense of the power here. The number of deaths is about 1,454 deaths per year in your median city. And then the mean temperature is 21 degrees Celsius. If you scroll up and down here, vertically within this table, this is broken out by country, and you can see a lot of variability within temperature by country, which is of course what we'd expect. So this box here on the left, so similar to the paper I talked about earlier, that estimated about a little less than 1% of total deaths globally can be explained by heat or attributed to heat. We found that for all-cause mortality, 0.67% of deaths among people of all ages can be attributed to heat. But this is a higher proportion of deaths among individuals aged 65 or plus, right? And this is what we would expect, that the older populations tend to have this higher vulnerability to heat than the general population. We're also able to look at this broken out by specific cause of death. So these are sort of large clusters of cardiovascular death, respiratory disease, which is chronic diseases, and respiratory infections. And you can see here about 0.69% of cardiovascular deaths can be attributable to heat. 1.1% of respiratory diseases or chronic disease, and 1.56% of respiratory infections or deaths from respiratory infections. If you look here on the right, what this represents, the shading of these dots, is this is the relative risk of mortality for 1 degree increase above the optimal temperature. And this is the city-specific optimal temperature, or the temperature at which we saw the lowest effect of ambient temperature on death. So what you can see here is that this, the relative risk of mortality per 1 degree Celsius increase varies a lot by geography, right? If you look in the middle here, these are actually the equatorial regions, the more tropical climates. And you see a 1 degree increase actually has a much smaller impact on death than these more temperate areas. You look down on the bottom, here's my pointer here. This is southern Brazil and northern Argentina. It's actually in the more temperate climates where 1 degree increase has the greatest effect on mortality. And what this really points to is differences in the ability to adapt to this heat. And there's other literature from other parts of the world that suggest this too, that some certain places perhaps have building design or other things that these societies have developed over centuries of living in this climate that help protect them. Whereas in more temperate areas, perhaps you have, say, you could think of in the US, you don't have air conditioning if you live in Maine. And if you have a hot day in Maine, you might see a greater impact on mortality than if you have a hot day in Georgia, where people may be more prepared. So we're seeing something similar here. There's this variability across the Latin American region, which we're looking forward to breaking out a little bit further and exploring more. So in conclusion, in Latin American cities, a substantial portion of deaths are explainable by hot temperatures. This was about 0.7% of total deaths. Older populations are particularly vulnerable. And these converging risk factors of climate change, urbanization, and an aging population really may greatly increase the health risk from extreme heat in the coming decades within Latin America. And policymakers must prioritize actions to prevent present and future health risks, particularly looking at vulnerable populations. So our next steps with this project in general is to look more closely at the land cover determinants of heat vulnerability within these urban areas, look at socioeconomic modification of heat vulnerability. We're looking at exposure to high temperature and birth weight. These are within the larger group of my colleagues here who are working on this project. And then take what we learn in this initial phase and carry it all forward to project forward with these different mid-century climate projections. That's all I have. I'm looking forward to your questions at the end. Thank you.
Thank you, Dr. Kephart. Now I'd like to introduce our third panelist, Dr. Ione Avila-Palencia from the Urban Health Collaborative. Thank you, Dr. Avila-Palencia.
Hello, thank you, Megan, for the introduction. My name is Ione Avila-Palencia. I'm a postdoctoral research fellow at Urban Health Collaborative here at Drexel University. And I mainly work looking at health and environmental effects of urban design and transport planning. So I'm going to talk about the linkages between urban design and transport planning effects and climate change. So I would like to start my presentation with a sentence that a colleague and a friend of mine who actually works in climate change research always says about climate change, which is that climate change is a context. It exacerbates existing weather conditions and it creates unprecedented situations. And I think this is a very important sentence to keep in mind when we talk about climate change and urban design, because the creation of unprecedented situations of more extreme scenarios forces us to decide how we are going to deal with them. And to do that, we have mitigation policies and adaptation policies, which is something that Dr. Fagliano have already mentioned in his presentation. So just briefly say that the IPCC defines mitigation as a human intervention to reduce the sources of greenhouse gases, and adaptation as the process of adjustment to actual or expected climate and its effects. So we should do our best to reduce the greenhouse gases that are creating the climate change with mitigation actions, but maybe we won't see the results of those mitigation actions after some decades. So at the same time, we need to accept that climate change is already here and we need to adapt to live with it. So what cities can do and are doing to mitigate and adapt to climate change? Well, cities can be a source of multiple environmental exposures like air pollution, noise, heat, green or blue space, or can promote or discourage factors like physical activity, among others. All this mix of urban exposures can be called the urban exposome. And as a public health researcher, I am mainly focusing how those exposures affect human health. But the truth is that the effects of those exposures go beyond human body's boundaries and also affect and disrupt nature dynamics. And depending how cities are designed and transport systems are planned, these exposures can be increased or reduced. And air pollution, heat, and green space have important roles in the climate change framework, as again, Dr. Fagliano has introduced at the beginning. So cities that promote a reduction in their emissions, for example, reducing car dependency and an increase in the green space area to help cooling the urban environment, they will be covering mitigation and adaptation actions at the same time that they are also increasing population health. And this is what we call the co-benefits. And cities can look very different and have very different outcomes or benefits depending on how they are planned. This is a classical example from the literature comparing two different neighborhood designs. On the top right, we can see a neighborhood design following a clear zone. So on the top right here. So this is a neighborhood design following a clear zoning pattern in which all the different land uses are clearly separated. And on the bottom left side of the picture, we can see an example of a more compact and mixed neighborhood. So if somebody lives in this house here, marked in red in the top right neighborhood, and wants to go to school, it will need to travel all this way, although that house looked pretty close to the school in the map. But if somebody lives in this house, marked in red in the bottom left neighborhood, and wants to go to school, it will need to travel this much. So although these two houses are in a kind of a similar distance from the neighborhood school in the map, due to their neighborhood design, the distances that they need to cover are very different. And it is very likely that the mode of transport they will use, it is different too. It is very likely that the neighbor who lives here on the top right neighborhood will drive a car, while our neighbor who from the bottom left neighborhood will go walking or cycling if there is also infrastructure to do it. So, and because we cannot just put things close and pretend that people will just choose active transport modes, for example, like walking or cycling, or use public transport, some interventions need to be done to promote those transport modes. Possible urban planning interventions to promote public transportation or public and active transportation are presented in this figure. And interventions include improvements to increase land use mix, density, connectivity, intermodality, which means being able to combine multiple transport modes, for example, cycling and being able to carry your bike in the train, green space, traffic calming, accessibility, and more. So at the end, it's about putting in the center what is the main aim and what do we want to put in the center, because cities can look very different. This is an example of Barcelona, Spain. It is the same space being designed, having cars in the center of the decision making on the left, and rethinking the same space, having people in the center on the right. In the example on the right, we can see a regain of the public space that can be used by people instead of by cars, and a considerable increase of the amount of green space as a result of this regain. So with an intervention like that, we are reducing the amount of cars, with the consequent reduction of emissions and increase of physical activity levels. We are helping to, and also we are helping to cool the city and providing shade to people. This is another example from Times Square, New York City, where public space was given back to people. In that way, people can just walk around, enjoy the public space, and build social cohesion through social interactions. So, and the use of public space is actually a very important issue in cities. This is how a planner looks the space a city has in the street. The amount of space that is dedicated to motorized transport, as you can see, is quite big. And actually, this is an example of a very transport mixed use of the public space. But I'm sure that if we all think about the streets of our neighborhood, the sidewalks are even smaller, and the predominant transport modes in the road are mainly one or two. So again, the amount of public space that is dedicated to motorized transport, especially individual motorized transport in cities, is huge. And more if we think about the different options that could be used and promote. So again, it is a matter of what is put in the center as a main aim and considered as a priority. And because if we do those changes, for example, we could have more space to plant more trees. And why not to say a city looks and it feels very different when instead of seeing cars, you can see faces in the street. So thinking about promoting different transport modes and the effects that this promotion can have. Here we have an example of an intervention assessment done in Salt Lake City. The dots here are the existing transit stops, and the squares that are following this line are the new stations. So this study looked people who lived around the new stations, and they measured their physical activity levels and their weight before and after the implementation of the new stations. What they found is that those participants who started to use the new service, they increased their physical activity levels and reduced their BMI. So this paper is mainly focused in effects in physical activity levels and BMI. But as I said before, urban design and transport planning interventions can have multiple benefits or co-benefits. So this is a great compilation of the different co-benefits related to bike use in cities. For example, in this brief, we can see 7 benefits of using a bicycle as your everyday mode of transport. It reduces the risk of premature mortality. It is a great source of physical activity. It helps to reduce the air pollution and noise levels in the city. It is a zero emissions transport mode. It helps to optimize the use of public space and improve your levels of well-being and helps you to be happier. So many different benefits can help to improve health and environmental exposures of the population. But again, how cities can promote, for example, cycling in this case among its population. So there is no single answer to that question, but one of them is to make it easy. A survey was run in Copenhagen some years ago, one of the cities that with the highest bike mode share. And most of the residents said that they used cycling because it is quick. And here there is an example of the same trip done by car and by bike in Copenhagen city. The car trip, the same trip, but done by car, it takes 37 minutes, while the same trip by bike, it takes 13 minutes. So I think it's very clear here. And this is not something that has been always like that. This is at the end a result of multiple urban interventions for many decades that have ended up that already in 2016, the number of bicycles entering Copenhagen city center exceeded the number of cars. So those are examples of a specific modes of transport. And for example, the example that of the transit intervention in Salt Lake City, or the general result of several interventions in Copenhagen, putting the bicycle at the center of the decision making. Those are just examples of a specific modes of transport. But what happens if we take a full city and decide to do an integrative intervention that can change a lot of different systemic dynamics? So I would like to have a look to the Barcelona superblocks model. So this is an example that I know because it has been developed for many years in my hometown. And it's also an example that we are also working on it as an example of a case study for the coming assessment report on climate change and cities of the Urban Climate Change Research Network. So Barcelona, just to put in context, Barcelona is a city from Spain, Europe. It is a Mediterranean city, which generally means dry summers and mild, wet winters. And it's a very dense, compact, and complex urban design. So the main idea of the superblocks model is to take 9 city blocks and close off the inside to through traffic. So any motorized vehicle has to drive around the superblock. And inside the superblock, the street space can be recovered to be used by pedestrians and cyclists. And we can also increase the green space, planting trees or different kinds of vegetation. And the complete proposal is to implement 503 superblocks all over the city, making the city a big network of superblocks. And several superblocks have been already implemented from the 90s until now, and more are about to come. And the last April 2021, the new Green Hub public space model was presented as part of the Superblocks program, and it is going to be implemented in one of the biggest districts, which is Champla, emphasizing the increase of green space in the area. And a health impact assessment study was actually published last year, evaluating the Barcelona Superblock model. And the study suggested that the implementation of the model could help to reduce harmful environmental exposures, specifically air pollution, noise, and heat, while simultaneously increase also physical activity levels and access to green space, and thereby provide substantial health benefits in the city. The study estimated that with the implementation of those 503 planned superblocks, almost 700 premature deaths could be prevented annually in Barcelona, translating into a substantial economic impact of 1.7 billion euros and considerable average gains in the life expectancy of almost 200 days due to reduction in harmful environmental exposures. So it seems that the superblocks model has a lot of potential of giving several co-benefits to the city of Barcelona. And not only the city of Barcelona, because at the end, this model can be implemented in other cities, and it's actually some other cities are trying to implement the model. And if not the model, because the urban design of the city, at the end, it's about the core values of recovering public space and use it for mitigation actions. So at the end, we have a diagnostic of the problem. Climate change is here and cities need to do something about it. And we need to take actions to stop, make climate change worse and to learn to live with it. And we need to do it now. So thank you for listening. I'm happy to answer any question during the Q&A, and also feel free to contact me by email or Twitter.
Thank you, Dr. Avila-Palencia. Now I'd like to introduce our final panelist, Dr. Leah Schinasi with the Dornslave School of Public Health.
All right, thank you. So, can you guys hear me? Okay. Thanks everybody. These have been really great talks so far. Oh, and I have my, hold on just one second. I have these subtitles keep on appearing. Let's see if I can, all right, there we go. All right, so yes, I'm happy to close out this seminar. I'm going to be talking about environmental justice and how climate change is an environmental justice issue. Actually, it's interesting, I saw one of the chats from one of the audience members about the talk that we just heard, and I think part of my talk addresses some of that, so stay tuned for that. And I also wanted to mention that I'm in a house with some kids, and so who are with a babysitter, so if you hear screaming or harmonica playing, don't be alarmed. So, okay. Oh, and I wanted to mention too, so my name is Leah Schinasi. I'm an assistant professor in the Department of Environmental and Occupational Health, and I'm an environmental epidemiologist and a lot of my research is on climate vulnerability. All right, so before getting started, I wanted to first introduce the concept of environmental justice. This is probably a review for some of you. It might be new for some of you. So Robert Bullard is a sociologist, and he's considered by many to be the father of environmental justice. In one of his early writings, he says, whether by conscious design or institutional neglect, communities of color in urban ghettos, in rural poverty pockets, or on economically impoverished Native American reservations face some of the worst environmental devastation in the nation. And so I'll be talking a bit about how climate change really brings that to light. And Bullard, he defines environmental justice as embracing the principle that all people and communities have a right to equal protection and equal enforcement of environmental laws and regulations. And so in my talk, I'm going to discuss how the climate crisis really represents a violation of this principle. So in particular, when we think about the communities who will be most impacted by climate change or who are already being impacted or have been impacted, they're those who have contributed the least greenhouse gas emissions. And for example, the map shown here, it illustrates that countries with the highest CO2 emissions per capita are also those that are most vulnerable to climate change, or sorry, least vulnerable to climate change. And then thinking a little bit more locally in the United States, Hurricane Katrina really showcased climate change related natural disasters as an environmental justice issue. So in August 2005, Katrina hit, and it led to extensive flood damage when several levees were breached and floodwaters submerged 80% of the city of New Orleans. And poor Black residents of the city who, because of racial residential segregation, were concentrated in the less desirable, lower lying and flood prone areas of the city. And they experienced, as a result, a disproportionately high burden of the adverse consequences of that hurricane, including housing damage, destruction, and displacement. And then heat also, which we heard a lot about in an earlier talk, is an example of a climate change related weather phenomena that to which racial, ethnic minorities and low socioeconomic position groups are most vulnerable. And a nice example of this is the 1995 heat wave of Chicago. It's a very famous heat wave that there's even a documentary about this now, and it resulted in hundreds of excess premature deaths. And the figure shown in this slide highlights that a tremendous number of those excess deaths occurred in Black residents of Chicago, and much higher rates were in Blacks versus white Chicago residents. And there are a number of explanations for these disparities. The figure shown here comes from a review paper that was published on this topic. And it illustrates the various ways by which race, ethnicity, and income may be related to vulnerability to extreme heat. For example, lower income or racial ethnic minority groups may lack private air conditioner use, may live in neighborhoods that are unsafe, and therefore may feel may not feel comfortable opening their windows. They might work jobs that require more outdoor heat exposure. So all of these factors contribute to differences in heat vulnerability. So the figure that I showed on the previous slide, that was a mainly theoretical one, though empirically informed. But there is also explicit empirical research that has started to provide some explanation for the racial disparities that we've seen in heat vulnerability. And so as one example, an analysis conducted, actually this is a little old already, in the mid-2000s, it showcased tremendous racial disparities in the prevalence of air conditioning in cities across the United States. And even more recent research has linked present-day heat vulnerability to historical racist systems and policies. And in particular, researchers have started to look at relationships between historical redlining maps in the United States and present-day heat vulnerability. By way of a brief introduction to those of you who haven't heard about redlining maps, these maps were created by the federally sponsored Homeowners Loan Corporation in the late 1930s. So the map shown here is one map. This is Philadelphia, and this was the Hulk map, the redlining map that was created for Philadelphia in 1938. So these maps were used by the agency to delineate neighborhoods that were risky versus not risky for issuing mortgage loans. So areas with a high percentage non-white, immigrant, and poor populations received the most risky grade rating, and so they were redlined. They are delineated on the map using red colors and graded as a D and highly risky. So an increasing body of research has shown that these historical maps serve as spatial representations of present-day urban environmental health inequities. So the New York Times reported on some research similar to what I'm talking about that was conducted on the relationships between heat vulnerability and redlining. So the figures shown here, which were published in that New York Times article, show these relationships in Richmond, Virginia. The researchers found that many formerly redlined areas in Richmond had lower tree canopy cover. And they also found that formerly redlined areas were particularly hot when compared with citywide temperatures. So this research showcases the fact that heat vulnerability characteristics, and in particular more intense heat exposures, are geographically patterned, and that these geographic patterns correspond to redlining, a historical form of institutional racism. And in general, this research contributes to a body of evidence that shows that climate change and heat vulnerability in particular is an environmental justice issue. So we just heard a talk about urban sustainability and adaptation programs, which cities are increasingly turning to in order to address some of these climate change issues. So a major focus of these are on land use, and the intention is to protect against climate change phenomena. And Ione in her talk discussed the many co-benefits of these programs, and they're touted for this. Co-benefits include air pollution reduction, active travel, and job creation. But some scholars suggest that climate adaptation plans may lead to what Isabel Anguleski, who's one of the scholars who's written a lot about this, and her co-authors in one paper called, quote, Urban Social Spatial Inequities. And some in general have begun to question whether these programs may exacerbate inequities. And so I'm going to close my talk by talking about these concerns for a few minutes. So in a paper that Anguleski and her colleagues published in 2016, the authors, they present the framework that is shown here in this slide. And the framework theorizes equity impacts of urban land use interventions. And the authors suggest that land use plan interventions, such as providing new protective green space infrastructure, can produce adverse outcomes for historically marginalized groups through acts of commission or through acts of omission. So investing in green infrastructure or creating new land use regulations that disproportionately affect or displace low-income and minority communities fall into the category of acts of commission. Whereas acts of omission are, for example, sustainability plans that protect economically valuable and already privileged areas at the expense of disadvantaged neighborhoods. And another act of omission would be, for example, failing to involve affected communities in planning or decision-making processes. So the example, one of the examples that Avila-Palencia and her co-authors use is the example of Katrina. So post-Katrina New Orleans, and the city's so-called Green Dot Plan, which the city proposed right after the hurricane hit, when it was in its early recovery process around year 2006. So the Green Dot Plan proposed to shrink New Orleans' urban footprint and to convert some of the lowest lying areas in the city, which were the ones that were the hardest hit by the hurricane-induced flooding, and also, as I discussed earlier, they were also predominantly Black communities. So they wanted to convert those areas into wetlands. The parks that were created would serve as ecological buffers for the nearby white communities, but they would end up displacing the residents who previously occupied the areas. This plan was eventually abandoned by the city because it was met with a lot of protest from the residents who were concerned about the impacts on them. So this is just one example of the inequities that some of these adaptation programs can lead to or exacerbate. So I want to say I'm not suggesting by any means that climate adaptation and resilience programs are not critical. I absolutely believe that they are, but it's important to consider the social implications of these programs. And I also want to say I do not have the magic wand solution to this incredibly difficult topic, but first and foremost, I believe that it's an important, actually a critical part of the conversation on climate change. And so finally, I want to leave you with just a few suggestions for coupling equity with adaptation considerations when we think about climate change. And I want to say that this list is not from my own brain. It's adapted from the 2016 paper by Avila-Palencia and co-authors that I've mentioned already. So included in this list are suggestions to communicate climate-related risks in a context-specific manner, to consider the potential for displacement or relocation of urban communities that might result from the adaptation programs that are proposed, to acknowledge that some community members may choose to stay in risky areas despite those risks, and in those cases to work to advocate for plans that are justice rather than profit driven. And so that's all I have for now. So thank you so much. And I look forward to questions.
Thank you, Dr. Schinasi, and to all of our panelists today. Now I will hand it over to the Q&A portion of the presentation.
Hi, so as we get started, if you feel comfortable, please start listing your questions in the chat and we will get to them. I'm gonna start with this one from Lisa. Transit, or that a little bit Leah addressed, but we'll just put it out there if somebody else wants to comment as well. Transit-oriented development often is biased towards able-bodied people and biased against elderly and/or disabled people. It also does not factor in the social factors, poverty and personal safety, that make it unsafe for many neighborhoods for people to rely on self-transit or mass transit. Everything seems to be geared to the ideal situation, not the real ones that exist in many urban areas. Panelists, would you like to comment further on that?
Well, I guess this question is directly related to my presentation. So I'm going to try to answer. So yes, I think that's a very good point. And of course, like when I present all the different ideas, there's always an ideal, and then each city has its own circumstance, right? But at the end, like the main idea at the end, it's to make public transportation and active transport, walking and cycling, available to everybody in the city. And I think that's what I was trying to show, showing the example of the superblocks model, which is a model that is planning, conceiving the whole city of Barcelona as a system and creating a network of superblocks. So all the intervention, it's done equally in all the city. I don't know if I'm answering the question here, but I'm happy to discuss more.
Okay, any comments from speakers? Attendees regarding this comment? No? Okay, let me go to another comment. Increasing tree cover is also possible by reducing the footprint of new buildings and requiring tree cover and green space. However, many transportation planners encourage density to the point that they don't recommend shrinkage of built spaces. A lot of space could be recovered by reducing the amount of space new buildings can build on, but this is counter to the idea of density being good. Comments?
Again, I think it's my turn. So yeah, that's actually also, again, a good point, and I think a kind of controversial one. And I think also thinking, for example, in the case of Philadelphia, that there's a lot of development now done with a lot of new buildings and all this. So yeah, I think it's a kind of complex, because if you think in general terms, the idea is that every year, like the population of cities and urban areas is just increasing and is going to increase. So at the end, people need houses, right? But of course, it really depends how this is managed. And I think here is when all related to this message comes. So at the end, it's like, yes, it's true that in some cases, maybe it could be done a park instead of a building. If building, it's more led by, profit-driven decisions. But at the same time, you also need to take into account that the population of the city is increasing. So you need to have houses for those people. So at the end, I think it's more about how you do the planning of the different land uses of the city and make sure that the cities have a proper mixed land use, which is something that is not happening in certain cities.
Great, thank you. Any other questions out there?
Marina, can I ask a question of Josiah?
Yes, please do.
I really appreciated the map you showed, which was really powerful demonstration of the sort of temperate versus tropical climates and the degree to which heat waves or increased heat causes harm in those populations. And then, you mentioned that there are lots of ideas of why that might be. Do you know of good research or data sets that can be looked at that sort of document the kinds of or the ways in which different communities have adaptation strategies in place that could be built into an analysis that you're doing to sort of disentangle, which factors really matter?
Yeah, that's a great question. I think I think there have been a lot of studies that have looked at specific things like air conditioning within more high-income countries, but that's probably less relevant on a big population level within our study area. So one thing that we're doing, a study actually that Leah is leading, is looking at greenness using satellite data to see how that might be a mediator of this heat and mortality impact. And we do have information from censuses on building construction, wall material, roof material, kind of basic stuff, but things that we will use as much as possible to try to disentangle that. But that's a great question, because that's, that really moves towards these, well, okay, so what do you do about it, right? So very important.
Okay, we have a question for Dr. Kephart. What is the potential pathway through which heat is associated with death due to respiratory conditions among older adults? Usually respiratory deaths are more frequent during the winter season, particularly among children.
Yes, thank you for this question. That's a great question. We were expecting to see a higher, based on the previous literature, a higher impact of respiratory deaths from cold weather than from warm weather. And what we see is they're pretty similar. There are a few different pathways. When your body's hot, you have full-on cardiometabolic stress. And if you have an underlying condition like asthma or COPD or things like that, where your body is already under stress, it can can trigger either an asthma exacerbation or a COPD exacerbation. So we're going to look into that further, but I think in general, it's this idea that your body is under stress from trying to maintain your body temperature, because that requires a lot of effort, trying to cool your body down. And if you have these underlying conditions, your body just is above its capacity to do all of that at once.
Great, thank you. Any other questions out there in the Zoom world?
I can add to Dr. Kephart's response just to say that in addition, heat could be associated with other environmental pollutants or respiratory irritants, and that could also be another pathway, but it's really complicated to study and understand because all of these things are so highly related to one another.
Yeah. Thank you so much for that. All right, well, barring no other question, I'm going to turn it back to Megan then to wrap it all up. Thank you.
Thank you. So I just have a few closing points. Thank you again to all of our wonderful panelists. The recording of this event will be available on the Climate and Sustainability website. Also, please join us on September 23rd for the next presentation entitled Sustainability on Campus. Corinne will drop this link, the link to register for this next presentation in the chat. Thank you all and have a great rest of your day.
Thank you, everyone. Thank you.